Hello friends. Nowadays we see elderly people going to gym. Many diabetic people are advised by their doctors to go to gym. They are advised 150 minutes of physical activity, and that should include going to gym also. But many other doctors tell the patients that for diabetes, brisk walk is all that is necessary. So what a diabetic should do? Should he go to gym? Should he do muscle strengthening exercises or only brisk walk? Today we shall see, is it essential for a diabetic person's exercise regimen to involve muscle strengthening or resistance training also? I am Dr. Prasad Honap and you are watching Let's Talk About Wellness. As we age, there is a loss of muscle mass, almost 1 or 2% per year till age of 70 and more than 2% afterwards. This loss of muscle mass is replaced by fibrous tissue or fat, both very slow in burning calories than the muscles. For a diabetic, this means poor sugar control. That is why it is important for a diabetic to maintain the muscle mass as long as possible. And the only way to do this is to perform muscle strengthening exercises and eating proper high protein diet. We have been told that for a diabetic only exercise that is needed is brisk walking. Nothing is far from the truth. Walking briskly, cycling, walking on treadmill, swimming are all excellent exercises that one cannot avoid, and walking is the easiest exercise. But the exercise regimen that a diabetic person must follow should consist of a few minutes of warm-up, then aerobic activity such as brisk walking or treadmill. This should also include muscle strengthening exercises involving different muscle groups at least twice a week. Exercise should end with proper stretching and cooling down. Both these activities are very important to avoid injury and muscle soreness. Though it is better to go to gym, you can do these exercises at home with handheld weights, resistance bands, or even using your own body weight. You can do push-ups, Surya Namaskar, squats, etc. What are the benefits of muscle strengthening exercises? Loss of muscle mass is postponed and minimized. Weight loss can take place. There is improvement in bone health, improves maintenance of balance, proper posture, thereby preventing falls as well as postural back problems, improves insulin sensitivity and helps proper utilization of glucose, improves the muscle tone and maintains a higher muscle tone for many hours after the exercise. A muscle with higher tone burns more calories per minute than a muscle which is flaccid or which has low tone. So these muscles continue to burn more calories long after the exercise has ended. Lowers the risk of ischemic heart disease and cerebrovascular disease. A diabetic person should perform physical activity at least 150 minutes a week. Muscle strengthening exercises involving different muscle groups should be done at least twice a week. Muscle strengthening exercises should be started moderately and should be incremental as you become familiar with them. It will always help you to go to gym, as you can learn the correct technique, correct form and proper stretching necessary for particular muscle group. All this would avoid injury. Lastly, one thing that a diabetic person should be careful about is fall in blood sugar called hypoglycemia. A diabetic doing exercise can experience hypoglycemia in various situations. Number 1, if he is taking insulin or drugs which increase the insulin secretion. Number 2, if he has skipped the meal. Number 3, if he has done really abnormally heavy exercise which he is not supposed to do. Number 4, if he has done the exercise far long time. All these things can lead to hypoglycemia immediately during the exercise or afterwards. Now, what are the symptoms of hypoglycemia for a diabetic can experience during exercise? Number 1, he can suddenly start sweating profusely. Number 2, he will feel hunger pangs. Number 3, he will suddenly feel severe weakness. He may be confused. He may be disoriented. All these signs are signs of hypoglycemia. And if you experience these signs, there is no time to lose, because hypoglycemia can be dangerous. And so every diabetic must carry a packet of glucose D powder or tablets when he is doing exercise. And as soon as he experiences first symptom suggestive hypoglycemia, he should consume 1 or 2 heaps of glucose powder or 4 or 5 tablets immediately and drink water. Once he does that, now he can do is consume fruit juice or eat a bar of chocolate. Even after this, if the symptoms of hypoglycemia persist, then person must contact his doctor for further advice. But remember one thing, hypoglycemia is dangerous but is very, very rare. And effects of exercise help the diabetic for a very long way. And the benefits of exercise far outweigh once in a while risk of hypoglycemia. So this should not desist you from stopping regular physical activity, including the muscle strengthening exercises. Thank you very much.